Hi, my name is Dr. Rasha Ali. I'm a comprehensive ophthalmologist and cornea subspecialist. So what is blepharitis and why is it important? So blepharitis is inflammation of the eyelid margin, and it can be caused by many different reasons. Predominantly what we see in clinic is something called blepharitis due to meibomian gland dysfunction. So meibomian glands are oil glands which are located on the base of your eyelashes. They exist on the upper edge of your eyelid and the lower edge of your eyelid. If these glands become blocked or occluded, then bacteria can proliferate there and cause inflammation in the blocked glands. Chronic blepharitis can cause significant discomfort, irritation, redness, pain. It can also predispose you towards forming styes, or it can cause a significant dry eye. The oil that comes out of your meibomian glands should coat the front surface of the eye, preventing your tears from evaporating too quickly. But if it does not come out and due to chronic inflammation, then you develop symptoms of an evaporative dry eye. Untreated blepharitis can cause chronic irritation, it can cause scarring of the cornea, and it can ultimately degrade the overall quality of your vision. Some conditions that predispose you towards blepharitis include rosacea. So rosacea is a skin condition which you might notice on your cheeks or your nose. Your facial appearance may appear mildly flushed. It's really a series of small, tiny dilated blood vessels on your cheeks or on your nose. And these inflammatory blood vessels can also make their way to your eyelid margin. When these vessels become inflamed, they predispose you towards significant blepharitis. There are a lot of risk factors that could trigger or worsen your rosacea. For some people, sunlight exposure, alcohol intake, caffeine intake, stress are all factors that could make your rosacea worse. We have multiple ways of treating rosacea blepharitis. So if you think you may be experiencing irritation, burning, decreased vision, and you think this may be due to rosacea, come on in and we'd be happy to take a look and help you out. Okay, simple steps to treat rosacea blepharitis. So I will always recommend that my patients start with warm compresses to their eyelids. What do we mean by that? So you can take a hot, wet towel and wring it dry. I always recommend testing it on the inner surface of your wrist to make sure that it's not too hot to the touch before you put it on your eyelids. Then you can lay this like a compress on your closed eyes for 3 to 5 minutes. You can also buy a microwavable gel mask. You can find these at any pharmacy or drugstore, or you can even purchase these online. And the same concept, you apply it to your closed eyelids for 3 to 5 minutes. After application of the heat, then I would recommend wiping your eyelid margins. There are commercially available wipes that are designed for wiping the eyelid margins, such as Sterilid or OcuSoft. You can find these at your drugstore. And what you'll do is take a wipe and you'll sweep from the inner corner of your eyes to the outer corner of your eyes, concentrating on the eyelid margin where your lashes are located. If you don't want to use a pre-moistened wipe, you can also buy these cleaning solutions in a foam format, and then you can wipe them off with a clean Q-tip or a clean towel. I typically recommend warm compresses twice a day, just sort of as maintenance therapy to keep your eyelids healthy. If conservative management with warm compresses and eyelid cleaning does not help your blepharitis, there are many treatment options available, including ointments and drops. We also have IPL, intense pulse light therapy right now. To determine which medication or intervention you're a candidate for, we'd be happy to see you in clinic to further discuss details. When to see a doctor for blepharitis? If you've been cleaning your eyelids and with warm compresses and towelettes and you're still symptomatic with irritation, redness, tearing, foreign body sensation, or decreased vision, it might be time to make an appointment to get further checked out.